Hello dear students, today we are going to learn about the febrile seizures. Febrile seizures are a very scary experience for the patients and for family members also. So today we will try to cover what are febrile seizures, what is etiology and its pathogenesis, how to investigate these seizures and how to treat these seizures. Also, what is the long-term prognosis, we are going to learn about all these things. Now, first of all, we will see what is the definition of febrile seizure. Febrile seizures are the seizures that occur between the age of 6 months to 5 years with body temperature 38 degrees centigrade or higher and not result of any CNS infection or metabolic disorder and occur in the absence of prior a febrile seizure. Okay, and incidence of the febrile seizures is almost 2 to 5% in all healthy children of this age group. Now there are two types of febrile seizures. One is simple febrile seizure and other is complex febrile seizures. So what is the difference between them? Simple febrile seizures usually are tonic clonic in nature and complex partial seizures they can be of multiple variations like tonic clonic, atonic, focal or myoclonic. Then maximum duration of simple febrile seizure is 15 minutes. They don't last more than 15 minutes. And complex febrile seizures maximum duration could be more than 15 minutes. They usually not recurrent within 24 hours. They can recur in 24 hours. Also, there is a very short post-ictal stage in simple febrile seizures. Along with this, we should also know about what is meant by status febrile epilepticus. So, when febrile seizure duration is more than 30 minutes, then it is called as status febrile epilepticus. So, moving forward, what is the etiology of the febrile seizures? Febrile seizures occur in a preceding viral infections like HHV6, influenza virus, H1N1. Also, some vaccines are associated with febrile seizures. So, what are those vaccines? DPT and MMR. Also, there is a positive family history febrile seizures in parents. So it's a sort of hereditary disorder. So what is the inheritance? It is a autosomal dominant inheritance. Okay. So moving forward again, how exactly these infections or these factors trigger the seizures? Any viral infection activates macrophages, and these macrophages release some cytokines like interleukin 1, interleukin 6, tumor necrosis factor alpha. And these released inflammatory markers can go in central nervous system and they have tendency to activate or bind to these receptors. So these are the NMDA receptor, and this is a nerve ending, excitatory nerve ending. These released inflammatory markers, interleukin 1, interleukin 6, tumor necrosis factor, alpha, they go to the central nervous system and binds with NMDA receptor. After binding, there is a lot of cationic influx into the nerve cells, and due to which increased cationic influx causes increased action potential and reaches to threshold potential, and there is a tendency to atrophy of the nerve cells causing seizures. Okay. After that, this interleukin 1, interleukin 6 and tumor necrosis factor can act upon the hypothalamic thermostat center, which causes production of prostaglandin E2. Prostaglandin E2 builds up body temperature, due to which there is a increased basal metabolic rate of the cells in our body, and this increased metabolic rate in all these neuronal cells causes hyperactivity of the neuronal cells, causing increased action potential and seizure activity. Increased metabolic rate leads to increased oxygen consumption by our all body cells. To take more and more oxygen, we have to breathe fast, and so there is increased respiratory rate. This increased respiratory rate causes carbon dioxide, that is or CO2 washout, and ultimately results into respiratory alkalosis. And this alkalotic stage of our body is again have trigger for the seizures. Febrile seizures have tendency for the recurrence till the age of 5 years, and there are some factors responsible for this recurrence of a febrile seizure. So what are those factors? Mainly those factors are categorized as major risk factor and minor risk factor. So what are the major risk factors? First, age. Suppose first febrile episode occurs less than 1 year of age, then there is high chance of recurrence of the febrile seizure. And suppose body temperature is around 38 to 39 degrees centigrade at the time of first febrile seizure, then there is also a high chance for the recurrence. And third, occurrence of febrile seizure within 24 hours of febrile stage. So these are the major risk factors. First, age less than 1 year, body temperature is more than 38 up to 39 degrees centigrade, and febrile episode or febrile seizure within 24 hours of the fever. And what are the minor risk factors for the recurrence of febrile seizure? First, family history of febrile seizure. Next, family history of any epilepsy. Complex febrile seizure. Complex febrile seizure have a high tendency for the recurrence than the simple febrile seizures. Also, low sodium levels Also, low sodium level at the time of seizure is also a high predictive for the recurrence of febrile seizures. And lastly, male gender is also responsible for the recurrence of the febrile seizures. So these are the major and minor risk factors for the recurrence of febrile seizures. Febrile seizures also have tendency to develop epilepsy in subsequent life of a child. So that is called as later epilepsy after febrile seizures. So what are those factors which are highly predictive of development of epilepsy in a child? So first of all, fever of less than 1 hour prior febrile seizure. Next, complex febrile seizure, which is focal type, also have high tendency to develop epilepsy in a child. Afterwards, neurodevelopmentally abnormal child. Neurodevelopmentally abnormal child has also tendency to develop epilepsy after first episode of a febrile seizures. Family history of epilepsy also have tendency for the epilepsy after first episode of a febrile seizure in that child. Now, how to evaluate a child who has presented with a history of febrile seizure? First, we have to take a thorough history. Thorough history will guide us to determine the type of seizure. Determine type of a seizure. It also gives some specific cause for the fever. So, history will help us to determine the type of a seizure and to find out the cause for the fever. Then we have to do a thorough examination, specifically neurological examination, to find out whether CNS infection is there or not. Okay. Then after taking a thorough history and examining the child, we do some investigation in this child. Usually, simple febrile seizure doesn't need too much investigation, but there are some situations in which we have to do some particular test. So, first of all, we send blood test like CBC, CRP, serum calcium level, and blood glucose levels. It is the BSL. Also, we can do serum electrolytes to find out the sodium level, and it has a marker for the recurrence of febrile seizure. Okay. After doing this blood test, we can do lumbar punctures. There is a specific criteria to do lumbar puncture. Usually, we don't do lumbar puncture in all patients with febrile seizures. Suppose child is less than 6 months, then invariably we have to consider this child as a meningitis and we have to do lumbar puncture and CSF studies. And more than 6 months to 1 year, in this age group, suppose child's immunization status is not known or child is unimmunized, then we recommend to do lumbar puncture. Also, there is history of not giving hib and pneumococcal vaccine to those children, then also we can order for the lumbar puncture and CSF study. So, unimmunized or immunization status is not known, and partially immunized children. After lumbar puncture, we can order for a EEG. Again, in all febrile seizures, we don't do EEG. Suppose there is a high chance of epilepsy in later life. In those children only, we have to do EEG. As we see previously, risk factors for the epilepsy in later life. So, in those situations, we can do EEG. So, epilepsy, risk of epilepsy in later life. Also, when child is presented with febrile status febrile epilepticus, again in these children we have to do EEG, and you can consider EEG in the children who have prolonged postictal stage. So EEG is done in a children who has high risk of epilepsy in later life, who has presented as a status febrile epilepsy, or who has prolonged postictal phase. And last, neuroimaging. This is done exclusively in children who have abnormal neurological development. Otherwise, in all cases, we can skip neuroimaging. Also, we can consider neuroimaging in a child who has presented with status febrile epilepticus. So, neuroimaging is done in abnormal neurodevelopmental child and child presented with status febrile epilepticus. So, these are the criteria to do investigation in a child presented with febrile seizures. Now, how to treat these febrile seizures? First of all, we have to counsel the parents. And give them emotional support. Counseling is done for the recurrence risk of a febrile seizure, also for later epilepsy in life. Then educate the parents about how to handle a seizure at home. How to handle seizure acutely at home. Okay. Then suppose duration of a seizure is more than 5 minutes. So in such cases, duration more than 5 minutes of a seizure, then we have to use lorazepam, diazepam or midazolam in such patients. Suppose convulsions occur at a home, then parents can use rectal diazepam or intranasal midazolam spray. So in hospital setup, we can use parenteral lorazepam, diazepam or midazolam to stop the seizures. Or suppose convulsions are occurring at home, then parents can use rectal diazepam or intranasal midazolam. Then frequently recurring febrile seizure. Frequently recurring febrile seizures. In such cases, we can use clonazepam or diazepam intermittently during a febrile illness. And clonazepam is used at a dose of clonazepam 0.01 milligram per kg per dose, given at a frequency of 8 to 12 hourly. And diazepam at a dose of 0.33 milligram per kg per dose, given at a frequency of 8 hourly. Also, we can use antipyretics to reduce the discomfort of a child. But remember, antipyretic don't reduce the recurrence of a febrile seizures. And lastly, screen for anemia, because anemia has high tendency for the occurrence of febrile seizures. So, screen for anemia. So, this is all about the febrile seizures. I hope this has made some sense and cleared your many of the doubts. Thank you.